Okay, so now we're going to go over the renal system. Again, going to be a brief overview of everything in here, and then we're going to go in more detail as we get into Module 3 as well. So what we're going to be doing is this act is basically coordinated with the digestive, cardiovascular, respiratory systems. The urinary system's main function, though, is we're getting rid of waste product, but we're also managing blood pressure. So again, dealing with fluids and retaining fluids, decreasing fluids, retaining nutrients, allowing nutrients to go out is all going to be a big balance that we're going to be doing. So blood volume and blood pressure is going to be a huge aspect that we'll be dealing with. Plasma concentration of ions to help stabilize the blood pH. So when we deal with our acid base, our kidneys and liver are going to be a huge function with clearing metabolic processes, as well as dealing with our lung, dealing with respiratory. So these are going to be compensatory factors dealing with our pH. We do have two kidneys, and basically they're going to be in the production of urine and getting rid of waste products are one of our main ways. Ureter is going to transport that waste or urine down to the urinary bladder. Bladder stored in the pelvis is temporary storage, and as that fills up, then it'll open up the urethra, and then that will exit to the exterior, getting rid of our waste products and excessive water, all with a balance. So the kidneys are located in what we call the retroperitoneal area. The right kidney sits a little bit lower than the left, and it has this peritoneal lining, basically the kidney is going to be floating into. So when we're looking into this page here, you can kind of see an aspect. So where we're dealing with the kidney, and I'm going to get my pen on here, our kidney is going to be located right here. And you can see the placement where it's sitting, located to the stomach, the pancreas, the spleen. And then when we're dealing with the spinal column, here's our vertebra right there. So we're kind of in that back area. It is protected by part of the ribs in the back, but it's also a little bit lower, right being a little bit lower. So it has some area of getting hit from the back. We look at the general aspect of this. We have our basically a dense fibrous covering layer that's going to be protected, and that's going to be our renal capsule. And then there's going to be this adipose tissue that surrounds it, and that's going to keep it cushioned and protected around there. It's all being held up by the suspensory ligaments. So if we take a look of a cross section here, you can see we have this outer cortex or thicker layer. Inside is going to be the medulla or thinner layer, and we have these renal sinuses that all come in and basically going to be holding all the fluid and bring it down. It'll go out to the renal pelvis, and then that'll go to the main hilum, or basically which is the opening or space that comes down into the ureter. As we look in this picture, basically this is going to have an inflow of water, and we have this is where it's going to basically control from the cortex to the medulla. And inside each of the medulla, we call these renal pyramids. And these renal pyramids right in here are going to be the main function of where the blood supply is coming into it here. The blood supply is going to come down, and then that's going to be going through the renal cortex and through the renal medulla, and that's going to be where we take out waste products. We check out the water, and in the end, we're going to be basically producing urine. So I'm going to get section over here. So our main aspect that we talked about with the bone is the osteon. We talked with the pancreas, it's the islets of Langerhans. Myofibrils for the muscles, and here we're talking about the nephron is the main system that we're looking at when we're dealing with the kidneys. So here's kind of a look at it. We have these efferent arterioles and these afferent arterioles, efferent going away, afferent coming into. It works in with the renal corpuscles and the blood vessels all coming down through here. And then we have this large loop that comes down, we call the loop of Henle. Then it comes back out to this collecting duct, and the collecting duct is what's going to drop it down into the hilum, and then that'll get out to the body. If we look a little bit closer in here, here's kind of where that circulation comes into there. So we have our renal artery bringing our blood in, That's going to bring our nutrients. That's what's going to be our waste products as well, going to be feeding out here, and then our renal vein coming back out. And each one of those is going to go through those little lobules through that pyramid areas of the medulla, and that's getting our blood exchange and receiving basically our input of fluid and taking it out. So we're going back into this area. A couple of the main spots that I want you to be aware of are going to be, and I'm going to switch over to my highlighter, the loop of Henle. This is where most of our exchange of fluids are going to be coming in, our collecting duct, where it's going to be coming out. We have our glomerulus. That's going to be our main areas with the distal and proximal convoluted tubules. And that's going to be where the initial exchange and balance is going to be coming in. And then through our loop of Henle is our long balance of coming through of replacing sodium ions, potassium ions, calcium, and getting through our waste products. And this is all going to be regulated by how we need to with ADH and aldosterone of regulating our blood pressure and how much we're going to lose, how much we're going to keep accepting in here in these nephrons. So our efferent arterioles, these are going to remove blood from the nephrons, and it's going to take it away. Again, efferent is away from, afferent is towards. Big things to know here. Our main areas coming in here, I'm not too worried about this. Like I said, the big aspects I want you to know is the loop of Henle, the collecting duct, and then our glomerulus. We'll get more of this into it. The renal tubule is composed of our convoluted segments there, our proximal and distal, and that's where a lot of those exchanges come into here. And here's an overview of that nephron when we're looking at the glomerulus, and it's basically the blood supply and the little capillaries coming all through here. That's about as most as I'm going to hold you to at this point in time. When we get into more of the renal aspects of the third module, we're going to go in really depth into that. Our blood pressure forces fluid out in the distal solutes, and that loop of Henle that we'll talk about is where we get a pressure gradient to get rid of our waste products and maintains our filtration. But our nephron is our main area that filtrates out the urine. It gets it very concentrated when we need to hold on to water, and it's very diluted when we're trying to exchange water. So when we're very dehydrated, we'll get a very concentrated urine, which will be mostly just waste products, and it's that darker in color, where when we're losing water and we have a lot of aspect there, it's going to be more of a clear. So it just kind of depends on how our body regulates on itself. Again, once we come into this, I'll get more aspect, I just want you to know the parts, the location, and identifying exactly what they do. So I'm going to kind of skip on that because we're going to go, like I said, we're going to go into more aspect of these later. I just want you to get here. The loop of Henle, this is that descending limb that we're seeing right down in this area. It's permeable to water, and this is where we get water moving out, and most of our gradient is going through here to balance everything out. So we've got our descending limb, our ascending limb of that loop of Henle. And then this is where we actively are getting that sodium and chloride as out of the area, and this is where we're getting really of our waste products and that concentration gradient. That's about as most I'm going to go over for that aspect of things right now. The basic purpose, again, is urinary production. It's maintaining our homeostasis, cleaning out our blood, and getting rid of our metabolic waste. Our main waste is going to be urea, creatinine, and uric acid. So these are all going to be balanced, and those are all important aspects later when we're going to talk about other areas. Creatinine, we're going to be special for looking and seeing how that works, because it's going to be working with our muscles and building up of skeletal tissues. When we see high concentration of creatinine in our bun level, when we're doing different labs, is going to tell us if we're seeing skeletal damage. We might see this in rhabdomyolysis. We might see it in other type of tissues, disorders that we want to check that. Our uric acid, we're going to be seeing when we're dealing with gout and arthritides, and how our waste is being managed from there. This is also going to be our reabsorption. So this is where we're going to basically be retaining calcium, retaining sodium based on whether we need to maintain our blood pressure or not. Our main aspect of control of blood pressure, kidney is going to be a huge aspect of that. Renin-angio system is where it goes to. So what we have is basically on that filtration is acted upon by ADH, aldosterone, progesterone, all different aspects we're going to be maintaining, which we'll go over specifically. But this is what regulates our waste product and regulates our blood pressure is the big aspects that you want to know. Major hormones that are going to be acting on the kidneys, angiotensin, ADH, aldosterone are going to be the three big ones that we'll be going over. They are basically a huge regulatory system, and it plays in part with our liver. And then as far as dealing with acid base, lungs and kidney are going to be our main source of regulating our body's waste product and balancing our acid base balance and maintaining at a specific level, so we're not too acidotic, but we're not too alkalotic either. We stay a little bit on the more acid level. I'm not going to go over too much here. Again, we're going to go high intensity on this in the class. So I'm not going to go over too much in here at this point in time. And that's basically the main things that I want to cover from there. As we're dealing with anatomy on here, again, I want you to know the two kidneys, the two ureters come into the urinary bladder. Inside the urinary bladder, this is where we're going to retain our urine and then basically come out through the urethra. We'll talk about kidney stones. I'm not too worried about you knowing from this aspect, but basically when we have problems with those and we maintain too much calcium deposits or magnesium deposits and uric acid crystals, those will condense together into basically little stones. They can get very large and very hard to pass. They will go through the ureters and can cause intense pain as you get a large mass trying to come through here and then passing through there. So there's different ways to break those down, but again, we'll get those over. I'm not too worried about you knowing that for this area. So those are the main points that I want you to hit through here. And I'm going to leave it off at that for right now. And again, we'll go more in depth later.